Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about tiagabine. What does tiagabine do? Tiagabine will inhibit, it inhibits GABA transporter, which is GAT1, and thus it is helpful in decreasing the reuptake into the neurons and glial cells, and thus it will decrease the reuptake into neurons and glial cells. By this decreasing reuptake, it will increase the duration of inhibitory synaptic impulses. It will increase the duration of inhibitory synaptic impulses, and it is also approved for refractory partial seizures. It is approved for refractory partial seizures. So this is about tiagabine. Thank you for watching.
Thank you and thank you for watching.